Anita Huberman. I'm CEO of the Surrey Board of Trade, and many of you are used to our regular huge Surrey Town Hall events that we have on the digital Zoom platform. This session that we have with the BC Liberal critics for the different ministries are in the form of a roundtable. So not a town hall, which means we can all see each other and you yourself can ask a question. And so a little bit different format, but it's to ensure that we have engagement with our partners at the BC government, which include our BC Liberal Party members. And I'd just like to start to say that we are gathered on the unceded territory of our Coast Salish people, specifically the Kwantlen, Katzie, Semiahmoo, and Tsawwassen First Nations. The Surrey Board of Trade, we are the top 10 largest chambers of commerce, boards of trades in Canada. There's 450 of us in our great nation. And Surrey, as you all know, is going to be the largest city in British Columbia. We are an opportunity city. We're a border city. We have the greatest number of manufacturers in British Columbia. We have a thriving construction and development sector. Many of our businesses were able to stay open during the pandemic. There are industries, though, that did suffer during the pandemic. And we are focusing on them in addition to others through BC's only Rapid Response Pandemic Center in partnership with the BC government. We also created Canada's first COVID-19 playbook for business to be a digital and in-person resource to help the business community and our stakeholders in terms of being a concierge of connections and to instigate change at all levels of government. So if you do have a question, I'm going to ask you to put your name in the chat function. And then I will recognize you to articulate your question. I ask you to be very respectful of everyone that is on this call. We have other MLAs that are joining us too, and they'll introduce themselves shortly as well. So just start putting down your name if you have a question. And if you have more than one question, I'm going to ask you to indicate in the chat function if you have more than one question. But first, let's hear from Renee Merrifield. She is the critic for the BC Government Ministry of Health. Renee, over to you for opening remarks, please.
Thanks so much. I really appreciate the welcome, and I definitely appreciate being here. And thank you, Anita. Your enthusiasm, it was contagious, so much appreciated. I also want to thank and just acknowledge my colleagues and local MLAs in Surrey, both Stephanie Cadieux and Trevor Halford, and just want to acknowledge the important work that they do. As you said, I'm Renee Merrifield, MLA for Kelowna Mission and the official opposition critic for health. The past few months for me have definitely been a whirlwind journey, just getting used to the role of MLA, but also stepping into the position of health critic. Oh, wait, during a global pandemic. So it has definitely been a very exceptional time. But today I wanted to start with a little bit of a story, and that is my entrance to Twitter. So as you know, Twitter is a very narrow part of our population. There's really only 57,000 BCers on the app. But when I first started, I found it so difficult. And in October, I was told I must, as a politician, be on Twitter. So I found it difficult though, because largely I could only use 140 characters. So those well-versed in Twitterdom seemed so adept at this language, this punchy, amazing 140 characters, but I always felt tremendously cut off. Like my thoughts were always partial explanations or partial comments, and so much was left up to interpretation. So I felt very constrained, but I ask, is this constraint a difficulty? And I'm sure that really as business people, we all experience this when we develop our brand. In choosing to be identified as something, we have to exclude so much else. So building a brand over time, what we become to the outside world becomes what we are, but it also becomes what we're not. Again, it's a constraint. Is this constraint a difficulty or is it an opportunity? This past year has been a whirlwind for so many. And the pandemic seemed to arrive overnight. And just like Anita said, it changed the way we work, it changed how we do business, our social interactions, and so much more. And as a business owner myself, I know that we've had to cope with a lot this year, from closures, changing regulations, the pressures of keeping your business open and afloat while revenues decrease. And like Anita said, many were very fortunate in staying open during the pandemic, and some were not. But none of us knew which category we were going to fit into at first. So, we, at my former company, we created a doom budget 1, 2, 3, 4, 5, 6, 7. And finally in June, we let it rest and we stopped calling it the doom budget. But in my role as health critic, I've heard from hundreds of people across this province expressing their concerns and their frustrations with some of the guidelines and some of the lack of logic sometimes that seems to be applied, but also the hopes. And I do my best to listen, but also to advocate. And that's why I'm really excited about being here today, because I want to make sure that all British Columbians' voices are heard during this time. And I've been working with the BC Liberal Caucus and my colleagues to really press government in a few key areas where we need to see more action. One of these that's on everyone's mind is rapid testing and why we haven't seen a greater adoption of this practice in BC. We have over 1 million of these tests stockpiled in warehouses, and they've been used with great success in other jurisdictions, yet they're still not widely used in our province. Nova Scotia declared these are a game changer, and Harvard-trained Dr. Michael Mina suggests that widespread rapid testing is the only way to control the spread of COVID. But instead, we have headlines coming from the US saying rapid testing in Canada lagging behind as US embraces the technology. And BC is actually being singled out as being the worst adapter. The World Health Organization says, a simple message to countries on how to deal with coronavirus outbreaks and new variants: test, test, and test. Speaking at a news conference, the organization's general director said he urged countries to test more suspected and unsuspected cases because he warned that we cannot fight a fire blindfolded. So why in BC are we not testing more? Why are we sitting on these tests? Well, I've been told it's because it's not perfect. The tests are only 70 to 75% effective. But isn't that better than nothing? I would argue yes. I've also been told there aren't enough resources to deploy. Nova Scotia, well, they used university students. We have long-term care facilities. They're more than willing to train their security personnel as well as their front end to test. So why can we not do this? It just doesn't seem right. Data disclosure has also been another central topic of conversation in my work as health critic. We have CBC journalists, moms on Facebook, and researchers from UBC and SFU all doing almost a better job in collecting and reporting the data than what the BC CDC has. We know that right now in BC, local governments, schools, businesses, individuals, if we don't have the detailed, up-to-date, and granular data that we need, we're not able to make informed decisions. And I worked with our education critic, Jackie Taggart, to write a letter to the Minister of Health asking for that greater transparency around COVID-19 data, simply so that the public has access to the information that we need to feel safe, and that businesses have access to the information that we desperately need in order to make decisions moving forward. So as we know, the light at the end of the tunnel is vaccines. And we know that vaccinating the majority of our population is one of the tangible actions that we can take to bring this pandemic to an end. The arrival of the vaccine, I can still remember where I was when Dr. Henry did her happy dance off screen because she didn't know she was being videotaped at the moment. And it really was an amazing moment of hope after so many difficult months. It's our step towards normalcy, and it's absolutely the vital tool in protecting our citizens and starting us on the path of economic recovery. But in order for the vaccine rollout to be successful, we need full honesty from government. And it comes back to the issue of transparency. We understand there are some parts of the process that are outside of the NDP government's control. However, we have to be open and honest with British Columbians, and we need to make it clear when people can receive their vaccine and let the public know immediately when and if anything has to change. Businesses need this certainty in how we are going to move forward. We need to ensure that the vaccine is efficiently and effectively getting to the people who need it, really, so that we can reopen and start the long path of rebuilding. So while at a time when we can turn our 100% of our efforts to that rebuilding is hopefully not far off, we have to remember the lessons that we learned during this time, and particularly the gaps that COVID-19 has revealed in our existing systems and structures. And it's important for me to ask, what did we learn and how can we do it better? It's important to use the constraints that we have to innovate, to make better and to move forward rather than sit in what was once good enough. And here's where I'm going to try and bring it all together. You see, whether on Twitter, whether building a brand, or even during a pandemic, we're all constrained. Constrained from writing more than 140 characters, constrained from being all things to everyone, and constrained with new regulations, information, and society in a way that we thought only possible in movies. But there's great opportunity in this constraint. And if we look for the possibility and innovation and opportunity, we're going to find it. I'm so proud of my colleagues as they continue to find that innovation and continue to ask for it. We're pressing for it. Take long-term care homes. They've been the location of some of the worst outbreaks in BC, and tragically, where so many lives have been lost. The pandemic showed clearly that there are gaps in the system, and there are very real ways that we can and must do better going forward. And our opposition leader and seniors critic, Shirley Bond, has been leading the charge and urging government to take action on these issues, urging government for greater transparency, urging government to make changes. But we also know that the pandemic has had a profound impact on mental health. And Trevor Halford, as our mental health and addictions critic, has been doing important work to encourage the government to provide better mental health supports in our communities, as the pandemic has revealed how much more work really needs to be done. In a conversation with my kids the other day, they're all 5 adult children, but all 5 doing Zoom University right now. And I was talking, kind of trying to do a check-in and be thoughtful about where their mental health was at. And my daughter stood up from dinner and said, flipped around and looked at me and she said, "I don't know, Mom. What about you being 21 years old and being told that your mom is the only one you can hang out with?" As much as I laughed at that moment, I went, oh my goodness, yes, people need people. Economies are built on people. Businesses are for people. And it really reminds us that we need to ask for every sector, how can we take the lessons learned through this pandemic into the future? How do we let it shape us and shape our approach to economic recovery? So my encouragement today is this: how do we take this pandemic and make it a beautiful constraint? Adam Morgan and Mark Barden write in their book, 10 years from now, we would like to Google a definition of constraint and see it include this: a limitation or defining parameter, often the stimulus to find a better way of doing something. And it's in my capacity as health critic that I'm going to continue to push for a better way of delivering health and wellness to all British Columbians, inside and outside of a pandemic. But I look forward to exploring questions in my role and working with you all today. Thank you.
Thank you so much, Renee. And I'm just going to take the liberty of starting off, and then I'll go to our roundtable guests. So I have a list of topics. I'm just going to go through all of them. If you could write them down and then respond accordingly. And I'm sure my colleagues will do the same as well. You talked about technology innovation. It really is an opportunity for innovation and partnerships related to healthcare, Cascadia partnerships around health technology, as well as new partnerships, especially in Surrey, new hospital. And we are going to be the largest city in British Columbia. We have been starved of healthcare investments. And just wondering what your thoughts are about technology innovation, international partnerships, and you know, vaccine production capabilities in British Columbia as well. Number two is related to your thoughts on the vaccine rollout. Uh, Frontline workers, such as ambulance, paramedics, police officers being included. You know, they're dealing with a lot of homeless populations, indigenous populations. You know, what are your thoughts about moving more people into that first phase of vaccine rollout? And number three is we completely agree with your perspective. We issued a policy around with the Canadian Chamber of Commerce in Ottawa, the need um, for more rapid testing technology, enhanced contact tracing, that being a game changer, especially for you know, those businesses, you know, that are in the 200s, the 100 employee phase. It's not perfect, we realize that, but every single ingredient in the overall recipe helps. And we did have a meeting with Bonnie Henry last week. And again, you know, she did respond that it is not perfect, but that they are looking at it. You know, as a measure to help the business community. And then the fourth topic is access to healthcare, not only today, but also into the future. What is your perspective about that? Leaving no one out, you know, those with disabilities, those indigenous populations, you know, that horrible case that we heard about in northern BC last week, I believe it was. So those are just my four topic areas, and over to you to respond.
Okay, wow. Nothing like asking like for the toughest questions first. Maybe we could start with a softball, you know, anyone want to talk? No, these are great questions and I really appreciate them. Let's start with your first, which I think was under a technology umbrella, but you also included some new investments. The BC Liberals have long wanted new investments in Surrey, and we actually promised them in our when we were still in power and in our last year in power. I still remember that. I was on the Interior Health Authority board at the time, and Surrey's been desperate for new healthcare investments within its borders. You're right; it's a fast-growing city. But what I'd like to caution against is a one-size-fits-all, because it's not one-size-fits-all. And you know, we're not going to build the same hospital in Surrey that we would necessarily build up north, or that we would necessarily build in other jurisdictions. And so we need to be mindful of making sure that our investment dollars are spent most wisely. When we look at Surrey, we need to look at the demographics, we need to look at the population, we need to look at the population growth, and we need to tailor something for that particular aspect. And so I'm big on healthcare investments. I am someone who wants to see more investment happen. In terms of the technology side, we have definitely seen a huge gap in our technology in the province. And you know, if you've spoken with Dr. Henry, then you know they're still receiving from each of the health authorities the data on positive cases via Excel spreadsheets. Then trying to amalgamate all of that, and the CDC, you know, then puts all of the demographic information into it. This is archaic, and any of our businesses would be flabbergasted or flummoxed to, you know, to even try and get the granular data that we need from this type of collection. So the gaps in our technology have definitely been seen. When I was still at Interior Health Authority, back when we had a BC Liberal government, we actually put out a huge transformational technology plan that then kind of you know, changed a little bit in the last 3.5 years, but did actually take hold, and we do have some new investments. And one of the things I'm going to be pressing government for in our next budget is to see these advanced faster. We don't need a 10-year plan. We need a 10-month plan to get these technological advancements moved forward. We need to be able to communicate via, you know, interhospitally, rather than, you know, having different EMR systems for every single one of them. I've also been meeting with technology companies who have solutions solutions for us. You know, they are sitting inside of our own provincial boundaries, so we don't have to invest outside of them. So I'm very bullish on where we can go with health and where we can go with technology, but we're going to need also infrastructure dollars in bricks and mortar, because the reality is that people still have to go to hospitals to receive care. So as great as we can get our telehealth, or as great as we can get other aspects of our healthcare, we still need to invest in hospitals. And that's something that the BC Liberals have a record of doing. We invest in infrastructure, and we invest in the actual hospitals. 10 of them in 14 years. So definitely, and Surrey was next on our list. Surrey was also promised by the NDP government. So we're curious as to why that hasn't occurred as of yet. So definitely very much so pressing government and making sure that Surrey has what it needs on that. One of the other aspects that we'll be pressing on that is also, though, more holistic care, looking at what we need to do for the whole person, and that encompasses mental health as well as our physical health. And I can touch on that more if we have time. The second question you asked was on vaccine rollout and frontline workers. I actively am advocating, and in my briefings privately with Dr. Henry, as well as on our caucus briefings, we are advocating for those frontline workers. There was actually a paper that was written by a UNBC professor, Dr. Elizabeth Dunn, and she indicates that right now us going by age is great up until about 75, but really after that we need to go with anyone that is in frontline work, and really we're advocating for that. I over my lunch hour, I was on the phone with a school principal, and they are advocating for their teachers to be accelerated as well. So we're looking at, yes, those that are in our firefighting and our police forces, as well as our dentists. I don't know if anyone's been to the dentist lately, but they walk in wearing a hazmat suit, and honestly, there's a video out on YouTube called "If Saliva Was Red." We need to protect these workers. We need to protect these people that are really doing a service for all of us. So we are advocating, and we'll go back at it right now. Teachers are in phase 3, A, B, C, somewhere down the line, and that's just not acceptable. They have to be farther forward, and frontline workers are all in that essential services category, which is in phase 3. In terms of the actual rollout, there are some hiccups. I was really pleased to see them actually hire a project manager. It was just a little bit too little too late. I wish they would have done it earlier. We should have had a plan and a vaccine rollout plan far earlier than what we actually saw it. And right now there's tons of confusion. As MLAs, we're inundated by people saying, when will I know it's my turn? How do I know what's next? The reality is we have this pause in our delivery, which is really no fault of the NDP. That's a federally regulated aspect of when our deliveries occur. But in this pause, let's make sure that we're doing things right. Let's make sure that we're communicating when people are going to see that vaccine happen. And if they can't say when, give it a number. Like give it a vaccine as soon as we hit 1,238,468 vaccines, you're next. Like it could be something like that, so that people could be just tracking vaccines and how many were completed and when they were next. I was recently talking with some relatives that live down in the States. They're U.S. citizens, so no, they are not on vacation. No, they're not having good times. But they were talking to me and they said, Renee, we have to educate you on what's happening here in Arizona. It's a military operation, and they've got stadiums, and people are driving through, and it's like a well-oiled machine. So I think there are other ways. I'm watching. Sorry, I'm on a very busy street, but. So ambulance. But I also have been watching other countries and jurisdictions that are doing it incredibly well. Israel's program has been exceptionally well received and very well executed. And I think that there's a lot of work to be done, and way, way more that we can do better. And there's a lot of concern. What was the statistic this morning? 40% of Canadians don't believe that we're going to be done by September. The EIA put out a paper last week on global vaccinations, and the EU doesn't believe that Canada will be done until 2022. So I think we need to take very seriously, and that's where I come back to, you know, what the caucus is working on in terms of all the other protectionary measures, you know, with rapid testing and approval of home rapid tests, you know, where you could just do it yourself. And we've got some UBC researchers that are actively working on these aspects, and I'm very excited about what could be done in the absence or in the delay of our vaccine. Rapid testing brings me to your next question. And yes, rapid test, rapid test, rapid test. We need it. Is it perfect? No. Can it be done? Yes. And should it be done? Yes. And it should be done on a wide scale. That's really where you get the best affect from it. Anyone feels anything, you can go and be tested and know within 15 minutes, oh, you tested positive, go and get retested with the PCR. So there was an interesting case or study that was done by actually YVR in collaboration with WestJet, and they rapid tested and PCR tested different individuals coming off a plane, and they did not have a single false positive. In fact, every single one of their positives was positive for both, and every single negative was negative for both. So that just, yes, we believe it's a 70 to 75% efficacy, but it might be greater. We just haven't had enough time with these types of methodology to know. And really, I think we need to be taking the gamble on it being good enough. And then access to healthcare, leaving no one out. This comes down to really our philosophy of healthcare and making sure it's broad, making sure it is fulsome, and that we aren't leaving anyone out. It does also involve using technology where we can't get, let's say, a surgeon. Can we get a robotic arm that can do that surgery? And you know, there are other uses of technology that are so forward and innovative, and right now we are not. We're kind of stuck in an old model. In fact, I recently was doing some research and pulled out, you know, a health paper back from the 1990s, and I was reading it going, oh my goodness, the recommendations were the same back then as they are today. Like it was almost a little disheartening to go, wow, we've only come this far. And I believe we can go farther. And if anything, I hope that we use the pandemic as a disruptor to really shake us up and have us go even farther to where we need to be. So with that, I'll take more questions, obviously, or detail anything that I've answered, but I wanted to make sure I left enough time.
Thank you so much, Renee. So now we'll go to Sujatha Nilavar for her question. Sujatha?
Hi, my name is Sujatha Nilavar. I'm a family doctor in Surrey, North Delta. And I echo and can relate to all your concerns. And I'm really excited that you're, going to bring these to the attention of our government because they are burning questions in our lives right now. As family doctors, we are also the pulse of our community. As many of you know, people will come to us for questions and resources with regards to the vaccine, and we also don't know, and that really frustrates us because we want to help and we want to get this done, and we want to move on too. My question is about healthcare services. Surrey North Delta has been consistently underfunded for years, preventing the delivery of proper longitudinal care to the constituents in living in both communities. What are your thoughts and how we could collectively work together? How can family doctors help, basically?
So when you say underfunded, where do you most see that underfunding?
Well, I think the pandemic definitely has brought out a lot of inequities. Namely, there's the mental health crisis that we have. Also, some of my colleagues that do maternity health, they're also having a crisis as well. Many times frequently diverting the deliveries from our hospitals. So we don't have the facilities to take care of our patients. For family doctors in the community, we feel that we don't have the resources that we can tap into our local health authorities. And then a lot of times it comes back to us because at the end of the day, we own our patients and we want to take care of them, but we're getting frustrated and we want to advocate. So that's why we're asking for your help.
Awesome. And thank you for the clarification. I do agree. And I think that part of the frustration is that we've spent so much money, but we haven't spent money in the right ways or with the right outcomes that are necessary. When you talk about maternity and sending patients to different hospitals, et cetera, that's a huge issue. We know that Surrey has one of the highest maternity births in all of BC. So we need to make sure that we are supportive and that we are making sure that the resources are there, and making sure that demographically we're responsive. You know, in a younger demographic, do we need as much long-term care as we do, maternity care? Well, no, we don't. And we need to make sure that resources are funded appropriately, and that, again, it's not a one-size-fits-all. But one of the other aspects of frustration that I've heard echoed, and I'm hearing from your question as well, is just that it feels really top-down. It feels like the Ministry of Health makes decisions that the Deputy Minister, actually implements, that then gets dispelled to all the health authorities and then goes out, into the different communities, with very little kind of feedback loops coming from those that are actually meeting with patients and that have the ear and have the voice. And that's something that we need to change, that we need to shift, that we need to make sure that we're moving forward on. So it really, this is a huge challenge. We're spending a lot of money right now on healthcare, and we need to make sure it's going to the right places and the right spaces. And that really comes from your voices. And even with my own constituency, I've started reaching out to all of the family docs and saying, what are you hearing? Where are you at? What do you need? Because it's really the resources. As far as mental health goes, I've been incredibly frustrated with a lack of budget. And this goes back, to before this last election. And I've been advocating, even in my private sector aspects, for more resources on mental health, and not just mental health, but also mental illness. And there's such a continuum and a misunderstanding. And so Trevor Halford, our MLA and your MLA here in Surrey, he's working really hard to make sure that we get a great communication. We were laughing on a call the other day because Corinne Kirkpatrick, who's an MLA out of West Vancouver, she's doing the child and family section, and then Trevor's got mental health, but it's funded through health. And so we're all trying to get the right questions to ask and the right monies going in the right directions. So I'm a big believer in the whole person, and mental is part of us, and we need to be funding it as we do anything else, and have resources for physicians like you when you have a patient that comes in to be able to have access to immediately. And so we're looking at wait times as well. If you have stories for us, like, hey, I called and they were given a 6-month wait time to see a psychiatrist, I'd be really, that would be useful information, just so that we know where the hot spots are in terms of getting those aspects of the healthcare system figured out.
Thank you. Elizabeth Modell, over to you.
Thank you so much, Renee. And you've actually answered a couple of my questions that I had. Very insightful and forward-thinking. But my question is a little bit of respectiveness from your part. Was, if you were the sitting government at the time the pandemic hit, what would you have done differently on your rollout of everything and the way it has been presented? Obviously, you've answered some of that already, but having said that, right from the initial start, what would you have done differently? That was the first part of my question. The second part of my question is, as opposition critic, what are you doing with regard to what is under federal jurisdiction, advocating for British Columbia in your role? Thank you.
No, thank you. Those are great questions. So had we been in government and had I been the health minister, I immediately, when the pandemic hit, would have started thinking about what needed to happen. We needed to triage and figure out what the virus was and what it looked like. And that really was done March, April, May. And I think that for the most part, Canada and BC did a fairly good job of that. Starting in May, we knew that a vaccine was our only way out of this pandemic. And to start thinking about how that rollout was going to happen, and to start working with national agencies like NACI to make sure that we were on board and in alignment with the national rollout. Well, The NACI guidelines came out in July. And when I was appointed as health critic in November, I actually thought, I think the government's hiding the vaccine plan from me, because I've asked for it 3 different times from 3 different people, and I got sent back to the first person that I asked for it from. And over the Christmas break, I had this, big aha that was like, we don't actually have a vaccine plan. We've had 10 months to think about this, to plan for it. We've had 5 months with national guidelines and working globally on a rollout plan, and we still don't have one. And I mean, the UK, if you look at when they came out with their guidelines and how it's been executed throughout, it's been brilliant. And I think sometimes we've gotten so specific with where it's going to go that we've forgotten that we need to do it in a really in a fast way and get it out as fast as we possibly can. My second biggest thing I would have done differently as health minister is I would have followed the dosing schedule as closely as possible. Because at that time, we just didn't know what was going to happen, and there were too many unknowns. And at that time, I was saying, to anyone that would listen, look, we don't know when a winter storm is going to come up north and going to delay our delivery times. Well, little did I know that it would actually be a Pfizer shutdown of a vaccine manufacturing plant in the EU that would dry up our supply. So for me, there were too many unknowns as to why we shouldn't be following the dosing schedule. And so we pushed it to 42 days. Now, in the last update yesterday, Dr. Henry was saying, well, maybe 90. I think that introduces some vaccine hesitancy that's unnecessary. I think that it plays around with the schedule and with the testing that has already been done by Pfizer. And I will tell you that on page 2,605 of the Pfizer study, they actually say that the schedule should be followed and should be followed as closely as possible. So that's a second thing that I would have done very differently. In terms of advocating federally, I have great federal resources and great federal access through a number of the boards that I've worked on in the past. And so I've been actually calling and getting as much data as I possibly can from the feds. Procurement is a huge issue. And, I think, Anita, you had asked about vaccine production in BC. I would advocate for vaccine production wherever we can possibly do it, because as we've seen, countries get very protective over their supply. And the US, President Biden, one of his first executive orders was to shut down the borders for vaccine to go anywhere else. The EU followed suit, the UK followed suit. We kind of got a workaround right now because we, as a federal government, donated to an agency that was supposed to procure for second and third world countries, but feels, oh wait, Canada doesn't have theirs yet, so they should get some. We shouldn't have to have workarounds. And we really fumbled on our procurement, and we're playing catch up right now. And that is no fault of the NDP government, but what we do get, we need to do the best that we can with it. And pulling it to 90 days in between dosing schedules and giving people, a 50% efficacy against the virus, I just don't think is wise. And if you look at every other province across Canada, outside of Quebec, we were the only ones that did it. And so other jurisdictions have more fully vaccinated individuals than what we have to date.
Tomas Reyes, you're next.
Thank you so much, Anita, and thank you, Renee, for being here with us today. So I am Tomas Reyes, and I'm the Executive Director for a nonprofit organization, the Surrey North Delta Division of Family Practice, which actually represents over 500 medical professionals in the community and 300 full-scope, full-time family physicians in the community. And Sujatha is one of them, plus she's part of my board. So she will make sure that actually what I ask is in alignment with what the physicians are asking, and it's not on a personal note. As you probably are very aware, the government currently has the vision of developing and implementing primary care networks in all communities across the province. And this is, of course, you should be very familiar with it because it started with a liberal government rather than the these PCNs, or primary care networks, are believed to become an integrated, robust solution to the current shortfalls in the delivery of primary care services, which is, as we have agreed already, a big gap in our community already and for so many years. From your perspective on knowing what you know from the past and from the original inception of them, are we on the right path on implementing them? And what would you do differently? And then how do family physicians fit within this PCN vision? We are in our own journey, by the way, to apply for funding and everything. So we are kind of right on the way, and we're finding some shortfalls from our perspective. And I'm curious to what you think about that.
Okay, so on the last part, you're applying for funding and you're finding shortfalls on which front? I missed that, sorry, my apologies.
Kind of the promise deliver and what we are finding as kind of the what we are probably going to get in the community to really close those gaps, particularly in relation to attachment, but also in general to access. So there is a little bit of a misalignment between what the message has been and then what we're finding out, although we're still in the journey. And so that's why I'm curious, are we on the right path? What could we do differently? What is missing? And
Well, so thank you. So Thomas, one of the things I would ask for is where you're finding that gap, can you let me know? We want to make sure that we are supportive to what you're asking for. So if there is more information that you can get to me on that front, that would be great. In terms of the primary care centers and model that we that started under the BC Liberals but has continued on under the NDP, my biggest concern is that we don't have the outcomes that we thought we would have from them. And largely that's the number of patient attachments that we're not seeing those increase to the same level. I have been doing some research on the primary care model and I'm looking at, okay, how do we tweak it? What do we need to do in order to change it? And some of that comes from how we're asking physicians to actually see patients. I think that the pandemic has allowed us to see a different way in terms of phone calls and virtual appointments rather than just everyone coming through a door. And I think that will expand and allow us to see more patients per day, just simply because you're not limited to the space. But having said that, there are other limitations within that. The other aspect is that we just haven't seen as many of them open as we need. So, we've kind of done these test pilot projects and we've put them kind of everywhere, but we haven't continued on that path and really done more of them. We knew from Interior Health and back 4 years ago that the FTE was changing, that a retiring general physician we were taking almost 2 or 2.3 FTEs to replace that one physician that was retiring. And some of these physicians were working 6 days a week, and I have no idea how they sustained it for that duration. And so I think we have to change our model. I think we have to change what we're doing and how we're doing it. I think we need to look at our FTE, and then that comes down to how many are we actually graduating. And we under the BC Liberals, we doubled our output of physicians. Our population continues to grow, so that we need to look at: are we continuing on that path in the same amount that we should be? And I'm going to be pressing government to make sure that we have enough physicians for our population, and that includes GPs, that includes specialists as well. And then the last part, which would go all the way back full circle to your first part, was making sure that we're spending the money in the right places and that we're getting actual outcomes for patient care and patient quality that for that money and for that investment. So I hope that answers for the most part, but I would love further information if you can give me. If you do see that there is a gap, I'd love to hear about it and know more, and then you and I can continue in dialogue and conversation about what we need to do in order to press government to get that full ask.
So Tomas, Renee's email is in the chat function. So if any of you would like to email her directly, please do so. So next, we're going to go to Anita Senga.
Thank you, Anita. Hello, Renee. I really welcome this opportunity for us to share our thoughts with you. I feel that the government, BC government, is missing out on an opportunity for the community and for small business leaders to play a part in the solution of this pandemic. And I'd like to talk about how COVID is managed has a direct impact on businesses, not just small businesses, but I just want to focus on that particular sector, and how basically managing COVID has a direct impact on small businesses and the livelihood of the economic engine of BC. Small businesses in BC employ 54% of all employed individuals. The transition in September for kids to go back to school was very stressful on parents. And if we can just make the assumption that 54% of those parents are employed in the small business sector, that was not good for the running of these businesses, which impact our economy directly. When we look at vaccine rollouts, logistics, rapid testing, and mental health, which are issues that have been brought up today, community and small business leaders can play a role in that solution. And I think the physicians have already mentioned that they'd like to play a role. I think it would be great to strike up a task force to allow us, the community, to actually help the government solve those issues. And you mentioned we aren't spending money in the right ways. We just need to create a task force. We can use our communities to solve these problems. And the one final thing I want to leave you with is sometimes government makes decisions for the best interest of the public, but it's really important to look at, for example, when people leave this province during the pandemic and come back, people are expected to incubate themselves for 14 days. Some people are doing that and others aren't. People have different levels of what they consider acceptable. It would be great for small business leaders to see that if we could put a facility that is paid for by taxpayer dollars to reduce the transmission of COVID so that people are in a facility for 14 days, and that would reduce the COVID transmissions in addition to the vaccine rollout. And I think that the small business leaders have lots of great ideas. We can work with the physicians, government, everyone work in the community together, even parents, to solve these issues. Thank you.
Awesome. I hear you. I agree with you. Small business is the lifeblood. And if you do any economic study, you're going to find that small businesses and entrepreneurs are the key to recovery, are the key to resilience, and are the key to innovation within any economy. And that's actually a quote out of a study that comes from the States, but is global in its application. So I fully agree. I think also, Anita, you hit on something that I'll come back to because, and I apologize if I don't say your name correctly, but Sujatha, is that correct? Also said, and that is that right now it's coming top down. And it really needs to be grassroots. We really need the voice of everyone. It's kind of the Toyota model, right? Innovation happens on every single level, in every single job, in every single way. And it's so true. And it's never been more true with the pandemic, because we are having to innovate and change and pivot on a weekly basis, literally. So I agree with you. I think that we need ideas. In terms of forming a task force, I'm open to ideas as to how to make that happen, and can certainly pass along in terms of small business to our critic, Todd Stone. But I would also welcome, and all of us as critics are wide open in terms of our email accounts to hear from you, hey, I've got a group of people that want to speak to you about, this topic. More than willing. In terms of the quarantine aspect, I think is what you were mentioning with the 14-day quarantine, that is being handled federally. They have introduced new criteria, and they are requiring anyone coming into the country to be quarantined for 2 weeks and charging every person, I believe it's $2,000 to do so. So there's been quite a flummox for those that are down in the, in the States or anywhere else that are all of a sudden having to extend their vacation by 2 weeks and pay $2,000 per person. But honestly, it's the only way we can try and keep the variants out and keep them to a dull roar. We need to be aware of what the variants mean to us. And I know they've been kind of downplayed in the media to some extent. We have 40 cases in BC currently. The South African variant, we don't know where it came from. we can't trace it back to travel. We can't trace it back to anyone that has been outside of the country. So that's concerning, because that means it's coming from the community. And the Minister of Health, he'll admit that they've been somewhat delayed in getting testing and screening capacity up and running. And so what we're left with is 5% of our positive tests being tested for these variants, which means we've got a whole lot more of it out there than what we've actually identified. So that's where the alarm bells come. Anita, you talked about going back to schools. Like I said, I was on the phone at lunchtime today with a school principal who's absolutely beside herself trying to get vaccinations for her teachers, because she says, we don't believe that they're going to be vaccinated by September, and if they're not, kids are not vaccinated at all, so they're going into the front lines with kids. So it's I hear you loud and clear, and I'm working with Jackie Taggart on that as well, on the education file, to make sure that we are pressing government. And you saw small changes happening. And really, we're making these, someone said to me, what, you're going to get more restrictions? I said, more restrictions means more freedom for the economy, and hopefully a restart program faster. So that's why we're advocating for rapid testing and, for other aspects of protection, so that we can protect the vulnerable and hopefully, open things in a timely fashion.
So Renee, I'm just going to ask 3 people to speak all at once, and then you can respond accordingly. So Baljeet, and then Doug Tennant, and then Dr. Rosenblatt. I'm hoping that you can speak on the concussion issue. We have a thriving health and technology district here in Surrey, but there is one area that has been overlooked that she's going to speak to. So Baljeet, over to you.
Thank you, Renee, for sharing your views and opinions today. I appreciate that. My quick question here is, although healthcare doesn't stop, age, young or old, and our focus in our whole system, in our whole country and the worldwide has been on the pandemic, I would like to know if you can share some insight in terms of other medical or health issues that not necessarily have fallen through the cracks, but are also needing some attention because they're not going to stop or be on hold because of the pandemics here. So what kind of constraints would they be pushing on our medical system financially, as well as, mentally, as well as having the resources available for that? Because we don't want those other, how should I say, that sick people be left behind because of the pandemic. So is there something you can sort of provide on that?
Okay. Yeah, thank you. Thanks, Renee. Mine is more of a comment than anything else, and it's a comment on behalf of people with disabilities, which my organization supports in a variety of ways, and colleagues that I work with. And my comment is that it's really important that we don't forget people with disabilities in all facets of the COVID-19 crisis, including the vaccination schedule, where some people with developmental disabilities have been moved forward a little bit in phase 3, but people who live in home share, for example, are at greater risk, but they have not been moved forward, nor the people that support them in the home share. Another issue that we're dealing with in the community living area is a lot of us would like to go to single site employer with our group homes, where people have significant health issues, the same, if not worse, than in many healthcare facilities. But we were excluded from the single site order, and that's something that is concerning to us. And then finally, with how the pandemic has greatly impacted and had a deeper effect in institutional settings, long-term care homes. My hope would be that yourself and the other MLAs on this call would be very supportive of affordable housing that's inclusive and accessible, where people can age in place and don't have to end up being warehoused in situations where COVID-19 really revealed some of the weaknesses in our health system. So, a way to save money on the health side by investing in affordable housing. Thank you.
Dr. Rosenblatt? Just unmute yourself, please.
So thank you for your time and the opportunity to speak with you. I think the thing I would like to perhaps raise today, and I suppose that it feels a bit disheartening to hear your recognition of the ways in which we've failed to perhaps address the pandemic with as much efficiency, or really maximizing that opportunity to protect the constituency in doing more, surveilling more, and just getting ahead of the problems that we could have, as well as responding to the problems we're facing now. And I wonder if it's possible, as you said, to use the constraints that we're recognizing as an opportunity. And perhaps a pandemic is a good place to begin to recognize the already stated epidemic of concussion in our province and certainly in our nation, to just address some of those issues. I know you raised the treating the whole person and the need to really consider mental health as well as physical health. And I suppose that one of the places that's most apparent and most critical, together with cognitive function, is in concussive injuries. And those aren't just sports injuries, which are the focus of academia and the research community, which does make some sense considering that we do have access to those subjects quite easily. But here we do have a raging concussion epidemic within the motor vehicle accident community, and have constraints put on that community, and the way to address those conditions through ICBC and insurers, third-party payers, as well as our medical system, which doesn't have reimbursement for the providers of concussion rehabilitation. It's not physician-based, it's rehabilitation professional based. And those would include neuropsychologists, physical therapists, occupational therapists, and so on. And so this has just been, a raging epidemic that we have failed to address. And the burden has been on small businesses such as Advanced Concussion Clinic to come up with approaches to manage these injuries, which of course then are further challenged during a pandemic, which creates all kinds of small business issues for us as well. So perhaps we might learn something from the pandemic and how we failed to respond to some issues, but also take an opportunity to respond to others and see if we can apply those. And as you say, learn from those constraints.
So Renee, the final questions for you to respond to.
Okay, I'll go as quickly as I possibly can. Baljeet, to your question, health issues needing attention. Ones that I would say are really top of mind in terms of health issues that are still going wildfire, but really taking a backseat to COVID: cancer and cancer research, and cancer technology. Our surgical wait times are through the roof. We did a surgical restart program starting in last May, $250 million. To date, we're 2,500 additional surgeries versus last year. Don't know where the money's gone, but definitely something that has to be dealt with. I would also talk about diabetes or ALS, but those would take a little bit too long. But then if we talk about gaps, and I'm gonna tie all these questions together, Doug, I hear you, and we are so fortunate to have MLA Stephanie Cadieux on our team and drawing our attention and making sure that we are absolutely sounding an alarm bell. And those with disabilities were left out. And we, in our last session, Stephanie went to bat for those with disabilities and in funding cuts, et cetera. But there are some issues that we still need to address. And your single site employees, absolutely, that should have been addressed. Vaccinations, yes, you guys are on the front lines. So definitely reach out to me after this, and I would love to engage in that conversation and make sure that I press government to make sure that those are moved. And then I'll end on your question, it was Dr. Rosenblatt, right? And that is on the concussive injuries. So my oldest son suffered massive concussions, and I I know that without resources, I would not have the son that I have today. I'm sorry for getting emotional, but the amount of resources it takes to actually do the rehabilitation that you're talking about is massive. And so I thank you for drawing attention to that. And absolutely, I will put that on my advocacy list because it is huge. And you could also, add different other therapies that have to take place, just even emotionally. For them to figure out how to deal, et cetera, but occupationally and physio, et cetera. And it's so time sensitive when dealing with a brain injury and brain recovery. So definitely, we look at those silent killers, right? The ones that like a concussion or like mental health, it's hard to see, but it's so there and so prevalent. So absolutely amazing. I just want to thank you guys so much for taking the time to be here with me, to give me your wisdom, your knowledge, your everything that you've done today. Please consider this the door opening to a conversation. My ears are wide open. I am listening, and I would love to further the conversation today, and make sure that you all get what you need and how you need it in the coming months. So we are going into budget time. We are going into estimates. Great time to ask questions. Great time to be on the cutting edge and the front lines of what needs to be done. And Baljeet, I'll end kind of wrapping around to your comment. So much of our health has been forgotten with the focus on COVID. And we absolutely need to remind government that we have a lot of British Columbians that are dealing with a wide myriad of issues that still need help. And we need to be spending money correctly. So thank you so much for your time and for your energy. And with that, sorry, I'll turn it back to Anita.
Renee, thank you so much for spending your time with the Surrey Board of Trade. And everyone, remember, Surrey is an opportunity city.